to talk about this first trauma-informed principle of safety as it relates to psychodrama specifically. And there's lots of different ways we can cultivate safety in psychodrama. And because of the experiential nature of the psychodramatic method and the power of it, it's especially important that we're attending to issues related to safety. In the past, many people were using psychodrama in ways that were not so trauma informed, and were not attending to safety in groups or doing things that really disrupted safety for people in the group, which makes it that much more important that we're attending to safety in our psychodrama practice. Some of the ways that we can cultivate safety in psychodrama is through a longer and more gradual warming up process. In some of my research, I found an inverse relationship between spontaneity and traumatic stress. And from psychodrama theory, we know that we only access spontaneity through a warming up process, which suggests that trauma survivors might need a longer and more gradual warming up process in our psychodrama groups than when we're doing psychodrama groups with others that's not focused on trauma. Using more sociometry can really help with cultivating safety, and employing strength-based roles and other safety structures within our group and within our psychodrama enactments can really help cultivate safety. So we can develop safety by creating opportunities for smaller group interactions, by maybe starting with shorter psychodrama enactments with just one or two other roles and working our way up to longer, fuller psychodrama enactments. We can even keep it really simple and direct and suggest that there's a role for safety within the psychodrama scene, and that somebody plays the role of safety, and that we check in about safety, that we reverse roles with safety and have the protagonist share what safety means to them and connect with a sense of safety and remind themselves that they're safe through that role throughout the process. Using strength-based roles, whether it's the role of safety or the role of courage or the role of love or humility or some sort of interpersonal support or transpersonal spiritual role, really helps establish safety. I like to think of strengths as the building blocks of safety, in that strengths provide physical, emotional, social, and symbolic markers of safety throughout the psychodrama process when we have strength-based roles present. It's a constant reminder to the protagonist of their ability to access support and safety when things get tough in the psychodrama. Another role that can really help with safety is the role of a double. And what I mean specifically here is not just the one-off doubling statements from the director or from participants in the group, but using the role of a double, enrolling somebody in the role, and having that double stay with the protagonist throughout the entire psychodrama process. There's lots of different types of doubles, but generally speaking, they all will stay with the protagonist, be attuned to the protagonist, and their job is to make statements that label what the protagonist might be experiencing or feeling, or to help the protagonist become more aware of their body and their environment throughout the process. Other ways that we can cultivate safety in psychodrama include maintaining attunement to each individual throughout the entire group process, not just the protagonist, not just the role players, but also the audience member. Spending the time to develop our therapeutic relationship with the protagonist, and leveraging other supports in the psychodrama for the protagonist and for other auxiliary role players or audience members, especially if it seems like they might need some extra support. In terms of maintaining safety in psychodrama, it's also important that once we get our contract for the session, that first of all, the contract is really bite-sized and realistic, but that we stick to the contract, that we don't change the contract midway without consulting with the protagonist and really consulting with the rest of the group who chose the topic if we did it as a sociometric selection, but that we make an agreement about this is what the issue is. This is what our goal is for the psychodrama, and here's our plan of what we might do. And we stick to that contract as much as possible. This really helps the protagonist feel a sense of security in what they're about to do and what they're about to experience, and not be caught off guard by us taking it in a completely different direction and going for a different topic, a different goal, without explicitly renegotiating the contract with them. The psychodrama conference this year in New York, I heard a psychodramatist, Scotty Ermy. She said in her workshop, the protagonist does not owe you a catharsis. And I really liked this quote. And I find this really important for us to remember. Of course, psychodrama can be very cathartic, and many times we might fall into the trap of believing that catharsis is cure, and that if we didn't have lots of tears and use lots of tissues in the session, that it wasn't a good psychodrama. This isn't true. Trying to provoke catharsis within individuals is not a good way of, not a good goal. Catharsis, of course, is often necessary to get through blocks and to let go of feelings and express what's going on for us, to dispel, to let go of, to release something that's been blocking us off. But catharsis is only promotes lasting change if there's some sort of integration after the abreactive catharsis, some sort of learning, some sort of role training, something future oriented, some sort of new perspective or insight that we integrate after the catharsis and the letting go. This is actually explicit in psychodrama theory. In Moranian philosophy, Moreno actually contributed pretty significantly to our understanding of catharsis. And he talks about all sorts of different types of catharsis and factors that contribute to catharsis. But in this context, I want to highlight, he talks about abreactive catharsis and integrative catharsis as two different types of catharsis, and that the goal of psychodrama is to get to an integrative catharsis after the abreactive catharsis. Of course, there's other ways of maintaining safety in a psychodrama. We need to attend to issues related to identity and related to connection, cohesion within the group. And the process of cultivating safety in psychodrama is going to look different from group to group. I want to challenge you for a moment to consider, as a psychodramatist, how are you actively cultivating safety in your groups? And how will you know if enough safety has been cultivated to move forward towards the contract and the goal that you've established with the protagonist in the group, especially if it's trauma related? Are you utilizing strength-based roles to keep the group and each group member safe? Are you utilizing a long enough warming up process? Are you utilizing doubling? Are you providing the protagonist with options throughout the psychodrama? This is another simple thing you can do. Something that I've gotten into the habit of is I'll start the psychodrama by integrating strength-based roles. What's the strength that you need in order to achieve this contract, to face the trauma that you wanted to deal with today? Now I need courage. All right, pick someone to play the role of courage. We have a conversation with courage. We reverse roles with courage. We reverse roles back. The protagonist takes in the support from courage. Maybe we have another strength-based role. Maybe they have a double come in. Maybe there's some sort of social support, that some sort of interpersonal support. And then I might offer options to the protagonist once we've established safety and some support for addressing the trauma. I might say, there's multiple different ways we could do this. Do you want to enroll yourself as a child and talk to yourself at the time of the trauma? Do you feel like you're at a point where you need to express anger to the person, a parent who wasn't there to protect you at the time of the trauma? Do you feel like we need to pull out an empty chair and tell the person who hurt you how much they hurt you, and to really reclaim some power back from this perpetrator? Do we need to look at how the trauma has been internalized within you and address it in that sense? Do we want to concretize the trauma and deal with it in a more tangible um, way rather than enrolling it? Do we want to talk to yourself in the future and get some guidance around addressing the trauma? There's so many different ways to meet the same contract within a psychodrama related to trauma. And there's lots of ways to meet a contract and promote healing without reenacting the trauma scene. I would argue that most of the time we don't need to reenact the trauma scene, that by the very nature of trauma and traumatic stress, the client is naturally re-experiencing the trauma, especially if they proposed a topic and proposed to be the protagonist and mentioned the trauma in their protagonist selection and in their contract. It's already going to be up for them. One of the symptom clusters of PTSD is intrusions and re-experiencing. So if the protagonist is already re-experiencing the trauma internally, we certainly don't have to re-experience it externally again. There's a time and a place to do that, and there needs to be lots of safety and safety structures implemented for the protagonists in the group. Keep them in their window of tolerance if we're going to go that route in a psychodrama. Usually, that's something we would do further along in somebody's trauma recovery if it was necessary. But there's lots of ways to heal trauma in psychodrama without doing that. And my inpatient research on PTSD and psychodrama is good evidence of it. In our inpatient psychodrama group, people are in the hospital. They're only going to be there for 2 to 5 weeks, and they're in treatment for stabilization. So they're often at the beginning of their recovery process. It's not the time to do a psychodrama reenacting trauma. Instead, almost all the psychodramas and psychodrama roles are strength-based, or we might bring in one antagonist role after building up strength-based roles, or do grief work, or a little bit of inner child work. The outcomes in that group show an average decrease in PTSD by over 50%. So the average person who participates in that inpatient group within the inpatient program and completes the program successfully experiences a 50% decrease in their PTSD symptoms. That means a majority of the people who met criteria for PTSD when they started the group and were admitted to treatment no longer meet criteria for PTSD diagnosis when they discharge. So that's evidence right there that we don't have to reenact traumas all the time in our psychodrama groups in order to promote healing from trauma and to reduce PTSD symptoms. So I really encourage us to reflect on this and the importance of safety in our psychodrama practice. So again, this is just the first of the 6 trauma-informed principles outlined by SAMHSA and in chapter 5 of my book on trauma-informed principles in group therapy, psychodrama, and organization. Of course, we can't fully cultivate safety and address this trauma-informed principle if we're not also cultivating the other 5 trauma-informed principles. They really go hand in hand. So if you found this video helpful, I really encourage you to check out some of the other videos on trauma-informed principles on our YouTube channel here. I encourage you to like the video, subscribe to our channel to get notified about future videos, and leave a comment on the video. Tell us what was helpful. Tell us what you learned in this video. Tell me if you think I forgot to mention something important about safety in this video. We're really interested to hear from you.